Good afternoon. This is All India Radio. I am Valsa Williams and with me is Rupinder Kaur Chawla with the Midday News. The headlines. Government permits import of 17 critical medical devices to provide relief to COVID patients. Over 1.70 crore people register in the CoWIN portal for vaccination so far. Portal works fine without glitches. More than 15 crore vaccine doses administered so far in the country. Health Ministry says more than 1 crore 6 lakh doses of COVID vaccines are still available with the states and union territories. Over 3,79,000 new COVID-19 cases reported and over 2,69,000 people recovered in the country in the last 24 hours. Railways continuously engaged in delivering oxygen across the country through its Oxygen Express trains. In West Bengal, polling for the 8th and final phase of assembly elections is progressing smoothly. In Uttar Pradesh, polling is being held for the 4th and final phase of Panchayat elections. And in IPL cricket, Mumbai Indians will take on Rajasthan Royals in New Delhi and Delhi Capitals face Kolkata Knight Riders in Ahmedabad this evening. As the number of COVID cases is on the rise, we appeal to our listeners to take all precautions and all those above 18 years of age to get vaccinated without any hesitation. The vaccination for persons aged between 18 and 44 would begin from 1st May at designated facilities. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene. And now the news in detail. The government has expedited the process of import of critical medical devices amid the growing demands due to COVID-19 pandemic situation in the country. In this connection, the union government has permitted importers to import 17 medical devices required to provide relief to COVID patients. An order issued by the Department of Consumer Affairs yesterday will remain in force for 3 months. The permission has been granted for import of nebulizers, oxygen and concentrators, CPAP and BIPAP devices, vacuum pressure swing absorption, oxygen plants and cryogenic oxygen air separation unit. In addition to these, permission has also been granted for the import of oxygen canister, oxygen filling systems, oxygen cylinders, including cryogenic cylinders, and ventilators, among others. The department has directed that the importers shall inform all such imports to the officials in the state where the equipment will be imported. Over 1.70 crore people have registered for vaccination in the CoWIN portal since yesterday. The portal handled more than 50,000 application program interface API calls per second. The vaccination for people 18 years and above will begin on Saturday. The government said CoWIN digital platform continues to work without any technical glitch. The Health Ministry said in the first 3 hours from 4 p.m. to 7 p.m. more than 80 lakh people registered themselves on the portal. The ministry clarified that media reports that the server of CoWIN platform has crashed are incorrect and are without any basis. It said there were 383 million API hits within the first 3 hours and as many as 1.45 crore SMSs were successfully delivered. The Health Ministry said the statistics indicate that far from crashing or performing slowly, the system is performing without any glitches. It is recording 55,000 hits per second and is completely stable. It said the CoWIN software is a robust, dependable and agile technology and it offers anytime, anywhere registration for COVID-19 vaccination. It said inclusivity, speed and scalability have been kept in mind while designing the unique digital platform with all components being portable and synchronous without excessive and unnecessary dependencies.
More than 15 crore vaccine doses have been administered so far in the country. Yesterday, more than 21 lakh vaccine doses were administered. In the last 24 hours, over 2,69,000 people were discharged. Health Ministry said in the last 24 hours, more than 3,79,000 new COVID-19 cases were reported. With this, total cases have reached more than 1 crore 83 lakh. Till now, over 1.5 crore people have recovered from infection. The recovery rate stands at 82.10%. The ministry said 3,645 deaths were reported in the last 24 hours, and the death toll in the pandemic has crossed 2,04,000. Active cases in India are now at over 30 lakh. Indian Council of Medical Research ICMR said over 17,68,000 tests were conducted yesterday, and till now over 28 crore 44 lakh tests have been conducted across the country. The Health and Family Welfare Ministry has informed that more than 1 crore 6 lakh doses of COVID vaccines are still available with the states and union territories. The union government has provided over 16 crore 16 lakh doses of vaccines to states and union territories free of cost so far. Of this, the total consumption of doses including wastages is over 15 crore 10 lakh. The ministry has assured that more than 20 lakh vaccine doses will be provided to states and union territories within the next 3 days. On the alleged shortage of vaccines in Maharashtra, the ministry has clarified that over 1 crore 63 lakh doses of vaccines have been received by Maharashtra so far. Of this, the total consumption including wastage was over 1 crore 56 lakh. The ministry said a total of 7,49,960 vaccine doses are still available with the state. It added that more than 20,48,000 doses of vaccines will be delivered in the next 3 days. The Health Ministry has said vaccination is a crucial pillar in the fight against the coronavirus, and the third phase of COVID-19 vaccination will be implemented from the 1st of May. The ministry has informed that the highest number of over 11,80,000 doses of vaccines are available in Uttar Pradesh, followed by Bihar.
Prime Minister Narendra Modi has sanctioned the procurement of 1 lakh portable oxygen concentrators from the PM CARES Fund. The decision was taken at a high-level meeting chaired by Mr. Modi to discuss the measures needed to improve liquid medical oxygen supply for COVID management. The Prime Minister instructed that these oxygen concentrators should be procured at the earliest and provided to states with high case burden. In addition to the earlier sanctioned 713 pressure swing adsorption PSA oxygen plants under PM CARES Fund, 500 new PSA oxygen plants have also been sanctioned under PM CARES Fund. The PSA plants will augment the supply of liquid medical oxygen at hospitals and district headquarters in Tier 2 cities. These 500 PSA plants will be established with transfer of the indigenous technology developed by DRDO and CSIR and to the domestic manufacturers. Prime Minister Narendra Modi today reviewed the Army's preparedness and initiatives to deal with COVID-19 situation in the country. The Prime Minister and Chief of Army Staff General M.M. Naravane discussed various initiatives being taken by the Army to help in COVID management. General M.M. Naravane informed the Prime Minister that medical staff of the Army is being made available to various state governments. He added that the Army is setting up temporary hospitals in various parts of the country. Mr. Naravane apprised the Prime Minister that the Army is opening up its hospitals for civilians. He informed that the Army is helping with manpower for imported oxygen tankers and vehicles where specialized skills are required to manage them.
Railways is continuously engaged in delivering oxygen across the country through its Oxygen Express trains. Railway Minister Piyush Goyal today informed that 6th Oxygen Express has left for Lucknow after loading liquid oxygen from Bokaro, which will increase the availability of oxygen in Uttar Pradesh. He further informed that Oxygen Express has left from Sikandrabad, Telangana to Angul, Odisha last night for getting liquid medical oxygen for COVID-19 patients in the state. Maruti Suzuki, the country's largest car maker, will shut down its manufacturing units in Haryana to make oxygen gas available for medical needs. Maruti Suzuki added that it is also decided to shut down its manufacturing unit in Gujarat. The company advanced its annual maintenance shutdown to 1st of May and said that it is committed to supporting the government in diverting oxygen for saving lives. The company has been informed that Suzuki Motor Gujarat has taken the same decision for its factory, Maruti Suzuki said.
In Uttarakhand, Chief Minister Tirath Singh Rawat has said the Char Dham Yatra is cancelled due to surge in COVID cases. Talking to media in Dehradun today, the web portals of the 4 shrines will be opened as per schedule. Tirth Purohit and priest of the shrines will perform rituals as earlier, but devotees will not be allowed to perform puja, archana at shrines. Portals of Gangotri, Yamunotri, Kedarnath and Badrinath will be opened next month. The Haryana government has issued directions for restricted sale, distribution of experimental drugs like injection remdesivir and injection tocilizumab used to treat patients with severe COVID-19 infection so as to stop their irrational use. A spokesperson of Food and Drug Administration said, keeping in view the emergency and unmet medical need for COVID-19 disease, Central Drugs Standard Control Organization has approved restricted emergency use of remdesivir injectable formulations for treatment of patients with severe COVID-19 infection. He said the government has also issued directions that remdesivir formulations are required to be sold under the prescription of medical specialists only. Further, remdesivir formulations are required to be supplied for use only to hospitals and institutions to ensure proper use of the drugs as recommended. He said the drug dealers have also been asked to keep a record of the corona report, an indoor card having mentioned name of the drug and record of the ID card or Aadhaar card for inspection purposes.
In the Union Territory of Jammu and Kashmir, complete lockdown is to be imposed in 11 districts beginning from 7 p.m. today and will remain in force till 7 a.m. on 3rd of May in view of the alarming surge of the positive cases being reported nowadays. Among the 20 districts of Jammu and Kashmir, Srinagar district is the worst affected, where cases continue to show an unabated rising trend. More from our Srinagar correspondent.
In view of the alarming surge in COVID-19 cases across Jammu and Kashmir, the district magistrates of 11 districts of the Union Territory have announced 84-hour complete lockdown beginning from 7 p.m. today up to 7 a.m. on 3rd May. The districts that will remain under complete lockdown include Jammu, Kutwa, Riyasi and Udhampur in Jammu division and Srinagar, Ganderbal, Baramulla, Badgam, Pulwama, Kulgam and Anantnag district in Kashmir Valley. Essential services will, however, be exempted from the restrictions of the lockdown. Meanwhile, as many as 3,023 fresh single-day spike of COVID cases was reported in Jammu and Kashmir, besides 30 fatalities during the past 24 hours. This is Sunil Kohl for AR News from Srinagar.
Positive news is coming from the state of Uttar Pradesh regarding the spread of COVID-19. In the last 24 hours, 35,903 COVID patients recovered from the infection and 29,824 new cases were reported. For the first time in recent weeks, the number of recovered patients is greater than the number of new infected patients in a day. From last 3 to 4 days, the number of new patients are coming down and it is below 30,000 per day, which was earlier around 35 to 37,000 patients daily. There is a slight decline in the number of COVID tests being conducted by state government also. Earlier, more than 2 lakh tests were being conducted every day, but now the number has come down to 1,80,000 tests per day. In state capital Lucknow also, the new cases are around 3,700, but more than 6,200 COVID patients have recovered in the last 24 hours.
In Punjab, 6,472 new cases of COVID were reported in the last 24 hours and 142 fatalities were also reported. 5,272 COVID patients have recovered yesterday. According to the Health Department, vaccination is in progress and 80,860 persons were administered COVID vaccines yesterday. In the Union Territory of Puducherry, private medical colleges have been directed to double the number of oxygen beds and ventilator facilities for the COVID patients. A report.
In a press release, the Health Director Dr. Mohan Kumar said that the private medical colleges are reportedly equipped with at least 100 oxygen beds and 10 ventilators. Now they are told to increase additional 100 more oxygen beds and 10 ventilators within 2 weeks of time. Meanwhile, in the UT, 1,92,910 persons administered COVID vaccination so far. The Health Department is making all arrangements for the vaccination of people above 18 years of age from May 1st onwards. The registration for vaccination already began. Today, 1,122 persons registered positive for the infection. 12 persons died. 564 persons cured and discharged. Chandramohan, AR News, Puducherry.
You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Government permits import of 17 critical medical devices to provide relief to the COVID patients. Over 1.70 crore people register in the CoWIN portal for vaccination so far. Portal works fine without glitches. More than 15 crore vaccine doses administered so far in the country. Health Ministry says more than 1 crore 6 lakh doses of COVID vaccines are still available with the states and union territories. Over 3,79,000 new COVID-19 cases reported and over 2,69,000 people recovered in the country in the last 24 hours. Railways continuously engaged in delivering oxygen across the country through its Oxygen Express trains. In West Bengal, polling for the 8th and final phase of assembly elections is progressing smoothly. In Uttar Pradesh, polling is being held for the 4th and final phase of Panchayat elections. And in IPL cricket, Mumbai Indians will take on Rajasthan Royals in New Delhi and Delhi Capitals face Kolkata Knight Riders in Ahmedabad this evening. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो कुछ वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
Welcome back to the Midday News. In West Bengal, polling for the 8th and final phase of assembly elections is progressing smoothly. The average voter turnout was registered at 56.19% till 1:30 p.m. The people were seen standing in long queues in front of the polling stations right from the beginning. The polling, which began at 7 a.m., will be conducted till 6:30 p.m. in 35 assembly constituencies spread over 4 districts going to polls today. Along with this, a re-poll is also being held at polling station number 126 of Shitolkuchi assembly seat in Cooch Behar district. In view of the prevailing COVID-19 pandemic, the option of postal ballot facility has been extended to the electors who are COVID-19 positive or suspect as certified by competent authority and are in home or institutional quarantine, along with those marked as persons with disabilities (PWD) and above the age of 80 years. The special facilities include mandatory sanitization of polling station, thermal checking of voters at entry point, either by polling staff or paramedical staff or an ASHA worker. During the 8th phase, total 283 candidates, including 35 women, are vying for the 35 assembly seats spread over 4 districts of West Bengal, going to polls today. Over 84.77 lakh voters, including 41.21 lakh women and 158 third-gender persons, will decide the fate of these candidates. Ruling AITC and Bharatiya Janata Party are contesting for all the 35 seats. Congress, the left parties and their alliance partner, Indian Secular Front, are fighting under the banner of Sanjukta Morcha. Bahujan Samaj Party has fielded 24 candidates. Congress has 19, CPI-M 10, ISF 4, AIFB 3 and RSP 1, while there are 87 independents, along with 65 others also in the fray. We now go over live to our correspondent Sudhindra for the latest updates from West Bengal. Sudhindra, tell us how the polling is going on.
Well, as you see, the battle for Bengal will culminate today when the 8th phase of polling concludes at 6:30 p.m. I am in AG's office, which is converted into a booth in Chaurangi Assembly segment in Kolkata North. And West Bengal Governor Jagdeep Dhankarji, he cast his vote here. And while speaking to the media persons after casting his vote, he appreciated the robustness of our democracy and how each phase of Bengal election saw overwhelming participation by citizens. And he appreciated the efforts of the Election Commission to ensure free and fair election and also enforcing COVID protocol. I also visited Belaghatta and Maniktala assembly segments in the morning today, and when I reached there at 7 a.m., I could see people in large numbers standing in queue in front of the polling booths. There was this incident of a crude bomb being hurled near Mahajyoti Southern Auditorium in North Kolkata, but no one was injured in this incident.
Right, and so what are the arrangements made at the polling stations keeping in view the spike in the COVID cases?
Well, yes, the COVID protocol had to be followed because the situation is such, and the polling personnel, security personnel, and the health workers coordinated well to guide the voters into the polling booth. And at the gate, thermal checking was done, and voters' hands were sanitized, and a plastic glove was given for the right hand. Then the voters were inked and on the left hand index finger and allowed to cast their vote. Just 1,000 voters per booth, so to ensure that there is no large crowd in front of the booths. And mask, of course, was a must for everyone. And the voters showed responsibility, I could say, by applying sanitizers on their hands and properly covering their nose and mouth while standing in the queue.
Thank you, Sudhindra, for those details.
In Uttar Pradesh, polling has begun for the fourth and final phase of Panchayat elections. The polling, which began at 7 this morning, will end at 6 p.m. More than 2 crore 98 lakh voters are expected to exercise their franchise in 17 districts. The State Election Commission has issued orders for strict compliance of COVID protocol during the polling. Voters will have to put up masks and maintain social distancing. Instructions have also been issued to make circles at a distance of 6 feet at the polling centers. The counting of votes will be taken up on 2nd of May. The Ministry of External Affairs has said that 40 countries have come forward to provide assistance to India to fulfill the requirements of several medical equipments and medicines in the country. Briefing the media in New Delhi today, Foreign Secretary Harshvardhan Shringla said consignments carrying medical equipments and medicines have started to arrive in India from various countries. He said the US has pledged to help the country in its fight against the pandemic. Mr. Shringla informed that 3 flights are scheduled to arrive from the United States within a week. He said 2 flights will reach tomorrow carrying the oxygen-generating equipments and oxygen cylinders. He said a cargo flight arriving tonight from UAE with ventilators and Favipiravir medicines. The Foreign Secretary said supply of liquid oxygen is one of the topmost priorities of the government. He said more than 500 oxygen-generating plants and 4,000 oxygen concentrators are going to arrive in the country within a few days. Mr. Shringla also informed that several global drug manufacturing companies have assured to provide medicines like remdesivir, tocilizumab and favipiravir.
The News Services Division of All India Radio in its bilingual live phone-in program tonight will bring you a special discussion on COVID-19. Dr. Prasen Panda of AIIMS Rishikesh will participate in the discussion. Listeners can ask questions to the expert on toll-free telephone number 1-800-115767. You can also ask questions on telephone number 011-2331-4444 and post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard on FM Gold channel and additional frequencies from 9:30 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates. In the Union Territory of Jammu and Kashmir, in the wake of the COVID-19 pandemic, the Union Territory government has put into service 108 ambulances to facilitate the people round the clock. More from our Jammu correspondent.
Through 108, 102 ambulance service, 1,843 COVID suspects have been shifted to hospitals for treatment till date, and lives of 4,650 COVID patients have been saved across the Union Territory. Adequate ambulances have been deployed in every district of the Union Territory to evacuate COVID patients to nearby designated COVID health institutions. These ambulances are having essential drugs to deal with any medical emergency and are fitted with critical life-saving equipments like transport ventilator, monitors, defibrillators, and most importantly, oxygen delivery system with specialized stretchers for shifting critical patients. J&K Emergency Medical Service 108-102 ambulance service is an initiative of the government in public-private partnership with BVG India Limited, which is a free-of-cost service for the general public. This program was launched in J&K on 24th March 2020, under which 139 ambulances have been stationed across the Union Territory. This is N. Gulshan Rana from AIR Jammu.
To support free vaccination drive, Congress MLA and MLC in Maharashtra have decided to donate 1 month's salary to Chief Minister Relief Fund. Congress legislator leader and Revenue Minister Bala Saheb Thorat has decided to donate his one-year honorarium to Chief Minister Relief Fund. He has also decided to pay vaccination charges of 5,000 employees working in his cooperative units. Pradesh Congress Committee is also donating 5 lakh to CM Relief Fund. Besides this, various Congress workers are donating vaccine charges of their family in CM Relief Fund. A series of earthquakes ranging from 6.7 to 2.9 in Richter scale jolted Assam and most of the northeast yesterday, causing damage to buildings and forcing people to scamper out of their homes. The CEO of the State Disaster Management Authority, G.D. Tripathi, said yesterday that no casualty has been reported due to the earthquake, but few persons sustained injuries. He said that several apartments, hotels, buildings developed cracks, and electricity and gas supply facilities were also disrupted in some places. Talking to AIR News, Dr. Mahananda Bora, geologist, explains what measures people should take before and after the earthquake.
When earthquakes, there are two main things that post-disaster activities means pre-disaster measurements should be taken. Pre-disaster include activities should cover management, engineering and seismological aspect. The management aspect cover preparedness and planning of disaster, education of public for awareness and emergency preparedness, preventive measure like earthquake resistant construction of structure will form engineering aspect. The seismological aspect, installation of seismological station to evaluate risks, networking for monitoring microseismic activity and collection of earthquake data to understand the earthquake.
Bangladesh has offered emergency medicines and equipment to India to fight the COVID-19 pandemic. The Ministry of Foreign Affairs, MOFA, of Bangladesh said it is ready to dispatch approximately 10,000 vials of injectable antiviral, oral antiviral, 30,000 PPE kits and several thousand zinc, calcium, vitamin C and other necessary tablets for the people of India on an emergency basis in view of the corona situation in India. Expressing deep sorrow and condolences at the loss of lives in India due to the spread of the COVID pandemic, Bangladesh expressed solidarity with India. It said at this critical moment, Bangladesh is ready to provide and mobilize support in every possible way to save lives. In Haryana, till April the 28th, an amount of 8,216 crore rupees has been transferred directly to the account of farmers for their crops procured by government procurement agencies. An official spokesman said that so far a total of 81.60 lakh tons of wheat has arrived at 396 procurement centres of the state, out of which a 77.77 lakh tons of wheat has been procured.
At the stock markets, the Sensex at the Bombay Stock Exchange rose 247 points or 0.5% to trade at 49,981 in the afternoon session a short while ago. The Nifty at the National Stock Exchange climbed 84 points or 0.6% to 14,948.
In Latur district of Maharashtra, 105-year-old senior citizen Dhenu Chavan has won the battle against coronavirus. His 95-year-old wife has also recovered from corona. Our correspondent reports that both were tested positive for COVID-19 in the last week of March. Their son, Suresh Chavan, says both were having fever. They were tested COVID positive and were admitted to government hospital in Latur for 8 days. He said both took treatment at hospital and came back after recovery. In IPL cricket, Mumbai Indians will take on Rajasthan Royals at 3:30 p.m. in New Delhi today, while in another match, Delhi Capitals will play against Kolkata Knight Riders at Narendra Modi Stadium in Ahmedabad at 7:30 p.m. And now, before we end the bulletin, the headlines once again. Government permits import of 17 critical medical devices to provide relief to COVID patients. Over 1.70 crore people registered in the CoWIN portal for vaccination so far. Portal works fine without glitches. More than 15 crore vaccine doses administered so far in the country. Health Ministry says more than 1 crore 6 lakh doses of COVID vaccines are still available with states and union territories. Over 3,79,000 new COVID-19 cases reported and over 2,69,000 people recover in the country in the last 24 hours, Railway is continuously engaged in delivering oxygen across the country through its Oxygen Express trains. In West Bengal, polling for 8th and final phase of assembly elections progressing smoothly. In Uttar Pradesh, polling being held for 4th and final phase of Panchayat elections. And with that, we end the midday news.